Hello there, viewers, and welcome back to a brand new episode that's part of the Specific Self-Care series for your body. In today's episode, we're going to talk about a specific condition and how to take care of a problem. This problem is one that we call text neck. Text neck comes from excessive forward bending of your neck. It's a movement that is done so much that it has become a chronic problem for many people in today's day and age. Because of this, I am going to be going over self-massage techniques and stretches you can do to undo those negative effects from a repetitive pattern. It really seems that texting is more common than a phone call. I grew up in a world where everyone's making phone calls like this, and being on the phone too long still is going to cause dysfunction in your muscles. But texting excessively also causes dysfunction, and both of those lead to problems in the neck and shoulders. This can also lead to the muscles chronically tightening simply from overuse. Since this is a common problem because everyone is always on their phone or working with a laptop in their lap or on a coffee table or a computer that's set down just a little bit lower, I'm going to take a few minutes of your time to teach you strategies for your neck for when you've been looking down for too long. I would suggest that even if you do not get text neck pain, but you find that what I've talked about already describes you, then you really do need to practice these self-massage techniques and stretches for your neck. Just because it's getting short and tight, you shouldn't wait till it gets painful and bad. The self-massage techniques that I'm going to teach you in this video are safe and gentle enough to do no matter what your skill level may be, but they still might be painful depending on how tight those muscles are. One of my other goals when teaching you this is to help you maintain a supportive posture. It's so important to me that you have a supportive posture as you take care of your body. There's no reason to contort your body to provide relief to a certain area. All those contortions can and will lead to new pains in your body. I'm sure even if you're at the level of Cirque du Soleil, you're still going to get some new pains. If you don't know what you're doing with your neck, you can really hurt yourself when you're trying to contort your body just for relief. So take care of your body. You only have one body per lifetime. So remember, follow along and practice as safely as you can, and watch this with a partner, and then use the partner to watch your form and give you feedback. If you do want online coaching for stretching and personal training, you can schedule with me online at the personal training and coaching website known as personaltrainertrainingonline.com and schedule a consultation call with me or your first appointment online with me. It's as easy as going to the website, booking and paying online. Just make sure that when you're there, you fill out the intake form and the other paperwork that you need to do before your first appointment. You don't want to be at your first appointment filling out paperwork. I normally don't have availability on that website, but right now I do have some time to take on a person or two for some regular training if they wanted. Early in the morning, Eastern time, but doesn't matter. But before we go back to this video, I want to warn you that what we're going to talk about for the self-massage, you're going to need to have tools handy. For this video, all you need to do is follow along with your hands, some small therapy balls, or a tiny bit of oil or lotion for some of the self-massage techniques that I will teach you. Any of the tools that I use in this video, I've left links in the description down below so you can easily just get what you need and then follow along with me the proper way you should be doing it. This particular pin and stretch technique that we're going to talk about for your neck primarily focuses on a strong neck flexor that's known as the SCM, aka sternocleidomastoid. The SCM is the largest and most easily accessible muscle if you know how to approach the area of the neck. The SCM, it starts and connects at the collarbone and at the chest bone, and then it travels up into the skull, connecting to a point at the back of your head that's known as the mastoid process. When this muscle gets too tight, not only are you going to feel it when you look up, but the tension can also radiate and cause trigger point pain that travels in your eyes, the back of the ear, the back of the head, and sometimes throughout the skull, creating, at times, it can create a muscle-based headache. Then when the tension in the muscles in our head, neck, and face get too tight, these can cause trigger point headaches. So stretching and self-massage of the SCM and other local muscles help to reduce headaches on a muscular level, but you should also get professional massage therapy to help release that. By the way, if you like what you're watching and you haven't subscribed by now, then make sure that you firmly compress on the subscribe button, and then while you're there, also make sure that you compress the bell icon so you are alerted when all videos will be released. Doing so is going to bring great joy to my heart and passionately create new content for your viewing pleasure. So subscribe now, it's free, and if you're already subscribed, share it to a friend. To start this pin and stretch technique, make sure that you take your fingers and you place a little bit of pressure just above the collarbone. If you're not sure that you're on the SCM muscle because you don't have experience, keep light pressure there and then tilt your head up. If you have the muscle under your fingers, you should feel it stretching and pushing up against your fingers. Now, and once you confirm it, if you haven't confirmed it first, just try a slightly different point and then try the looking up technique again. Now, once you've confirmed that you found it, what you're going to do is you're going to, with lightly oiled hands or lubricated hands, you're going to pin the muscle there right before stretching. And then to stretch, you're going to just look up at the ceiling. You're going to maintain pressure just above your collarbone. You're going to hold and you're going to breathe. You can use a second set of fingers to help keep it in place. Hold and breathe. You'll wait about 30 plus seconds into the stretch, 30 to 60, and then once you're done, you can release, you can reset, then you can proceed to do the same technique on the other side. I am not going to do it on my left hand side, your right hand side, because that is where my microphone is and I do not want to cause all that disruption from hitting it. So make sure that you find the muscle at the bone. Then before you stretch, keep pressure there, look up, hold 30 to 60 seconds, then release. Make sure you're doing your deep breathing, because when you do your deep breathing, your breath signals to your nervous system that we need to turn off fight or flight part of our nervous system, and we need to activate the rest and digest part of the nervous system. Doing so and activating that other part of your nervous system is going to help your body accept the stretch and really lengthen and receive maximum results, because you want to get those maximum results. The next stretch is a personal favorite of mine, but I guess if I teach certain stretches, I would have personal favorites. This one's called the SCM side bending neck stretch. This is a great and versatile stretch, if you ask me. It's great for when you've had your head bent to the side for too long, or when you've been looking forward for too long. So it's versatile because it covers stretching in two movements, because this is great for when you're texting for many hours in a day, or you're holding a landline phone between your head and your shoulders for too many hours in one day straight. Aside from flexing the neck, the SCM also works with other muscles to perform side bending and rotation movements. If you're lacking range of motion in your neck, your SCM muscle might just be super tight. This is a stretch that lengthens the SCM, and other muscles that assist with the action of side bending are totally just do the action of side bending. So to do this, I want you to start with your head in neutral position. It means your spine is nice and straight and your head is over your shoulders. Then you're going to find the side that you want to stretch, get those fingertips just above the collarbone, hold, place light pressure. Then I want you to bend the side of your head, keep those fingers down, hold in place, and feel the intensity of the stretch as you side bend. Hold and breathe. Have the fingers, two sets of fingers, one creating pressure over the other, and do your deep breathing. If you don't remember how to do your deep breathing, then the video is going to be up overhead and links will be below, so you can watch those deep breathing videos. But hold and breathe 30 to 60 seconds. Then when you're released, when you're done, you just bend your head. You return to that neutral position for your neck, and then you can proceed to do it on the other side. My microphone's not here, so I'll just talk you through it one more time. You find the SCM area that's right by the collarbone, and then you create pressure there, and then you stretch away from that pressure you created, doing a side bending stretch. Hold and breathe 30 to 60 seconds. Then when you have done both sides, you have stretched out the SCM and other muscles that perform the action of side bending. The next one's going to be fun because the learning's never done. And this next technique we're going to do is using a therapy ball in the back of the skull in a move that I call the SCM Therapy ball release technique. Now, this particular technique is effective in more ways than the average person might realize because this is a busy area in the back of your skull. While it attaches to muscles like splenius capitis, it also releases the SCM, which is a primary neck flexor. And this is a great self-massage technique to do at home to reduce stiffness and soreness and restore range of motion in your neck. Because treating this area works on both the flexors and extensors, it helps achieve maximum effectiveness for maximum results and helps restore imbalances effectively. The spot in the back of the head that we're going to focus on is a little bony bump behind the ear and on the skull in an area that's called the mastoid process. What I've learned as a massage therapist is that in this area, most people really don't ever get touched. So what that does in turn is it makes the area more sensitive when it finally does get touched. Because most of you have not had a massage treatment over this area, you must go lightly when you perform self-massage to yourself because the nerves are going to be very sensitive here. So just quick warning. Also, before I show you the technique, if you like what you're watching, then I want you to firmly press down on that like button. Hit like because every time you hit like, a computer chip gets a massage. So lol. So to begin, what we're going to do is take our tiny set of massage therapy balls. I use those Melt Method balls. I'm just using one. I just showed you two of them. They usually come in a bag, which is a set, and I'll leave links in the description if you need to get a set of your own. All balls you can use for your body, but none of them are good, not even something as small as a golf ball. You really do need these Melt Method balls to do this technique. While we're going to begin to do this technique, what I want you to do is go to the back of your head, go behind the ear, and go down to the back and the side of your skull. And you'll feel a bony bump just in that area. Now, what you'll do is you're going to place pressure and side bend. You should feel the SCM pull. Right? Then once you confirm that you're over it, I want you to go back to neutral position. Put the ball right over the muscle and the bone that you feel, not directly on the bone. Ooh, I can feel this already. Whew, give me a second so I can keep talking. I told you it was sensitive. All right, so now once you have pressure on there, what you're going to do is exactly what I did when I created the pressure and it caused a shock. You're going to hold and you're going to breathe nice and deep. Create that pressure till the intensity goes down to a better state. It could go to zero, but it doesn't have to go to zero. Hold and breathe. Okay, the intensity has gone down by many manageable levels for me. At first, it was so intense I really had to stop talking, and you saw that happen live as I was recording, but I was able to talk a bit more and a bit more. Now that it's been close to like 45 seconds, maybe 60 seconds, I haven't been timing, it feels a lot better. Once I'm done, I can take it off. Then I would do the same exact thing, go to ear, go back, go down. Then once you're there, side bend away from your shoulder to confirm. I should actually use the other set of fingers on the opposite side to confirm you're on the SCM, that back part. Then once you're there, get the little ball in there, create the pressure, replace your fingers with the ball, hold, and breathe. Whew. Again, I can feel it. Just maintain that pressure there. I'm gonna take that pressure off a little early. Make sure you hold it till the intensity goes away and try to keep it above 30 seconds, going more likely to 45, 60 seconds. Hold and get that release. And then when you've done it on both sides, congratulations, you've just officially learned how to use a tiny massage ball for the back of your skull to help reduce pain for neck flexing. But also when you do that, it's a great self-massage technique to just help relieve tension overall in your skull, because that's what us massage therapists are for. We release tension wherever it is. And trust me, years of experience. I already have plenty of tension in there. I felt it in others. And it doesn't matter if it's, our biceps that get tight from exercising, our legs from squatting or running or whatever, but everything, even the muscles in our face and our head, need to be released with massage and sometimes self-massage techniques. But it's not even that I'm going to massage everyone I'm speaking to watching this, but I would recommend massage first, then self-massage as maintenance and self-care, so that way things don't get worse and you make things better at home. So the next self-massage technique that I'm going to teach you is a self-massage technique for the neck flexor muscle known as the SCM. Now please know that this muscle is part of your neck and it should be treated with great care, just like any other muscle in your neck, but it is important for you as an amateur to give only light pressure in this area, because under the muscle you'll find a major artery known as the carotid artery. This artery feeds blood to your brain, so don't get crazy when applying pressure here. Also, please know that if you feel lightheaded as you do this, then please back off and stop immediately. You could be cutting off the blood flow to your brain, and that is not an option, as the Marines say. If you feel a pulse as you self-massage, then let go, reset your hands, and try again. This is a broad stroke, so if you do not feel comfortable doing this, I understand. Please watch only. If you are in New York City and would prefer me to work on it, then schedule a massage appointment over at EliteHealersMassageTherapy.com. I'm a New York State licensed massage therapist. I have also taught techniques to future massage therapists as a professor at a university. So not only have I practiced massage for this muscle, but I have taught others to treat this muscle and other muscles in the neck, so I have total confidence in my treatment techniques. And if you need me, I'm here for you. Simple as that. Now, to do this particular self-massage technique, we're going to have a broader approach to the muscle, because this is going to be safer for everybody watching there. We're going to use the palm on the thumb side of the hand to perform this technique. The hand will be cupped. You're going to want to use a light amount of oil or lotion for your hands when doing this one. I prefer Earthlight water-soluble hypoallergenic massage oil because of its lack of allergens. It's super safe to use on many types of people. And if you get in contact with your clothes, it's water-soluble. So that makes it so much easier to wash out your clothes. My one tip for you is just don't wear white when you're using any type of massage oil. Yellow always overpowers white, and oils come in all different shades of yellow. So to begin this technique, we're going to start with that hand lubricator, like I mentioned, fingers together, side by side, along each other with the thumb. This helps protect small joints and muscles in your hand while providing the fleshy aspect of your palm for work. Now you're going to take this cupped hand and place that thumb side of the palm on the opposite side of your hand that's opposite to your neck. You're going to rotate your head away lightly from the area that you're going to treat, and then what you're going to do is you're going to make contact and rub lightly. Stroke should go back and up. Hold and release. Do this for about 15 to 20 seconds. Then after you're done, you can prep the other hand, have it in that cup shape right there. Bring it to the neck on the opposite side, that's opposite from your working hand. Rotate away, then provide that cupping, stroking motion. If you look, I'm not only using my hand, I'm using my shoulder. And in this case, if I was working on person, I'd be using my full body, but I'm just kind of using rotation in my body along with shoulder movement and hand movement. This compounding of movements on multiple joints takes less pressure off those working joints, so that way as you're taking care of one area like your neck, you're not getting like your hand tired or your shoulder tired because you're using multiple muscles from multiple muscle groups to help create that action, you know. And remember, I understand if you can't do this on your own, you just schedule an interview. Let's do this over. Let's schedule an appointment if you're in NYC for your massage therapy with me, and I'll take care for you. Now that's the video, and we're through. Thank you.